Physicians and dentists agree, improve your oral health and you will improve your overall health and well-being. When left untreated, dental disease can cause other health-related problems, potentially increasing the risk of heart attacks, strokes, respiratory disease, and diabetes. For those in need of tooth replacement, dental implants remain the state-of-the-art solution, giving the aesthetics, function, and feel of natural teeth. Over the past decade, zirconia has become the material of choice for tooth and implant crowns. Now, zirconia implants are becoming an increasingly popular aesthetic and healthy tooth replacement solution. Dr. Ted Fields, a Dallas-based oral surgeon, explains.
We used to, in dentistry, think that the mouth was more of a separate entity, and research is increasingly making it clear that that's not the case. One of the big advantages of zirconia as an implant material is plaque adhesion, and bacterial adhesion is less than many other materials that we use in dentistry, and this allows a healthy soft tissue response, minimizes inflammation, and gives us long-term healthy aesthetic soft tissue. They look really nice and they support long-term oral health. It's the first material that I've seen in oral surgery where we actually have patients requesting a specific material.
Zirconium oxide is derived from metal zirconium, but it has lost all the metal properties due to the chemical reaction. Metals are characterized by certain characteristics and properties like electrothermal conductivity and free electrons, but the ceramic material, as a consequence of the chemical reaction, does show a completely new set of characteristics. It does not show any of the characteristics of the original materials. Not all zirconia materials are the same. Their characteristics and strengths very much depend on the way they are processed. Literature and clinicians report that they see less plaque and healthier soft tissue around zirconia implants. This is most likely related to the low surface free energy of this material. Another effect is the hydrophilicity or wettability of this surface.
Zirconia has been used in orthopedics for the past several decades, and Z-Systems pioneered the use of this material in dentistry.
Z-Systems USA is a subsidiary of Z-Systems. Our mission is to develop and provide high-performance ceramic all-zirconia dental implant solutions to the dental implant market to help improve the quality of life for dental implant patients.
Zirconia implants are being used at world-renowned institutions and by authors and key opinion leaders in implant dentistry, who use them in their teaching applications.
There are very few parts of the procedure that are unique to zirconia implants, so the learning curve for this is not a steep one for dentists and dental surgeons. Restoring these, placing posts, and ultimately teeth on them also is a pretty simple procedure. In fact, it's very similar to what dentists currently do to restore natural teeth.
At the same time, zirconia implants offer advanced technology. Its simple execution protocol makes the implant procedure familiar to implant dentists.
The main thing I look at is the health of the tooth on either side. If the tooth on either side of the space is very healthy, there's no reason to damage them or cut away part of the tooth in order to do a crown or a bridge. Whereas with the implant, it just goes in between the two teeth and doesn't affect the tooth on either side.
I was initially attracted to zirconia implants for the aesthetic benefits. Obviously, eliminating dark lines around the gum tissue, having ideal aesthetic restorations, and that's why I started using these implants. But what's kept me a big advocate of these implants is the soft tissue response. In other words, the health of the tissues around these implants was impressively better than anything I had seen previously, and that's what really kept me coming back.
The beautiful thing about this system is that there are benefits for both the patient and the dentist. For the dentist, the familiarity and ease of use of the system, as well as customizable technology when restoring the implant chairside in the patient's mouth. And for the patient, it's the brilliant white smile, the beautiful pink and white aesthetics you get from zirconia implants.
With over 37,000 implants placed, Z-Systems is committed to the improvement of your quality of life and natural smile.
For me, it's like having my original tooth back. I have no pain at all. I can eat everything, including nuts or anything that's hard. It functions as well or better than the crowns that I have on the other side of my mouth.
I would definitely recommend it. The functionality is actually excellent, so I can't really tell the difference at all between this implant and my previous tooth.
Zirconia implants are great to restore full chewing function, full normal speech, another function that we don't often attribute to our teeth. For anyone who's missing teeth, who's looking to replace those teeth in a long-term or permanent fashion, zirconia implants are typically a great option.
Swiss Precision, FDA approved since 2007, and complying with rigid safety standards, Z Systems creates an outcome that's hard to match. To learn more about Z Systems zirconia implants, go to zsystemsusa.com/in America.